Hey everyone, it's Dr. Daniel Sugai, board certified dermatologist. Thanks again for supporting the channel. I'm back again for a Dr. Sugai Explains body acne, butt acne, a little bit of fungal acne, which is a social media term, I'll call it. That term went viral because of people talking about the fungal aspect of some acne issues that can happen on the face and body. So we'll delve into that. So let's talk about body acne. The formal medical term is folliculitis, which is, if you break it down, follicle-itis, inflammation of the hair follicle. We are all covered with hair. Hair follicles, especially on our back, can get clogged or occluded with exercise. Us guys, we do have a little bit more oily skin, and we do get clogged up pores on our back and hair follicles. They can get infected. And so after a workout, my tips are try not to go inside and let your sweaty clothes get in contact with your skin for very long. Try to change out of your clothes and shower right away. When you're working out, try to avoid tight-fitted clothing. Once you are wearing tight clothes, everything's going to get occluded onto that area, and you can get folliculitis on your legs or your buttocks. Just the lower extremities in general. Especially if you're done with the gym, you go into the car, you sit down, all of that bacteria gets pushed into the skin. And that's called occlusion, where it really gets sealed in. When you get home, try to change out of your clothes and take a shower right away. What do you wash with? That's a big question. What cleansers are there to use? You could use a gentle cleanser. Yes, totally fine, especially if you have dry skin. But if you're suffering from acne, you're more likely having oily skin. My two options that I like to go for would be something with benzoyl peroxide. This is CeraVe's, you can tell I use a lot of this, CeraVe's Acne Foaming Cream Cleanser, which is 4% benzoyl peroxide. It has really nice ingredients in it that I love. As you all know, it has 3 essential ceramides. It says hyaluronic acid and niacinamide. The ceramides are to help repair and rebuild your skin barrier and keep it intact. Hyaluronic acid is a humectant that draws in water. We use it in cosmetic fillers to help draw in water, plump up your skin. This will do the same and is great in moisturizers, but this cleanser has it as well. And niacinamide, which is anti-inflammatory, also helps with acne. So it has these nice things that will help with your folliculitis, but also prevent you from drying out too much. Because the biggest critique for benzoyl peroxide is, one, some people may even get like an allergy or an allergic rash to it, but some just have drying out or irritation from it. And that can happen with the higher concentrations of benzoyl peroxide, especially as you get to the 10% range. I used to recommend 10% benzoyl peroxide to my patients, but now we know better, and we actually say that the concentration between 4 to 10%, they're all about the same. So it's all about the tolerability does go down as you go up into higher concentration. So this is just a nice sweet spot, 4%. I do like this one a lot. I used it a lot on my face and my body, especially after taking down my mask and having oily skin from wearing my mask all day in clinic. This is a nice way to degrease. Benzoyl peroxide is a nice ingredient that's antibacterial, kills the bacteria. It also helps exfoliate the skin, helps clean out your pores. And it's a very nice thing to pair with your prescription acne medicines, especially the antibiotics. If you're on a topical or oral antibiotic, it will help prevent you from getting resistance to those antibiotics. So this is a very important ingredient if you can tolerate it. If you're pregnant, I would say don't use it. Use a gentle cleanser instead. The other thing you could consider is a salicylic acid wash here, like Neutrogena. I know people hate on the oil-free formulation of this. I have not had issues with this, but people do not like it. I guess they say it's too drying, too stripping, but it's 2% salicylic acid. The other option, if you want to stay away from Neutrogena's 2% salicylic acid wash, is La Roche-Posay's Effaclar 2% wash. This is a very nice option here. I'll put the prices up above. And you can try out either one. But this is, as you know, salicylic acid is a beta hydroxy acid. There's alpha hydroxy, beta hydroxy. This is beta hydroxy. Beta hydroxy acids are great because they're oil soluble more so than the alpha hydroxys, which I love putting in using for my chemical peels in office. Beta hydroxy acid or salicylic acid. It's oil soluble, so it does go down into your pores and cleans out all the junk in there. And that's a very nice thing for acne or folliculitis. And so if you want to clear out your pores, this is very nice to use on your face or your back. Again, if you're pregnant though, I would avoid this as well. Some doctors are saying maybe it's safe to use, but for me, if you're my patient, I'm going to say don't use these products if you're pregnant. All right, so that's pretty much it. I did make a TikTok video on this with these product mentions and also just the tips of really quick fire tips on getting under your clothes and not wearing tight fitted clothing and washing right away. It did pretty well on TikTok and especially on Instagram Reels. So check it out. I'll do a little snapshot here without the music, of course. So what do you think? A little obnoxious with the dance, but it's a viral trend dance challenge. I had a good time making that video. But the other thing is, if you don't have access to a shower right away, I would say at least have some gentle cleansing wipes. I like Cetaphil's cleansing wipes to have in the gym bag if you want to wipe down yourself very quickly and try to remove some of the oil and dirt right there at the gym. You can try that out. If that's just a temporary measure before you go home and wash off your body. It does not replace a shower, of course. If these fail, I do recommend going to a dermatologist to get other treatment options prescribed. You could try a retinoid, like over-the-counter Differin gel, which is a tiny tube for a large price. So you might want to go to a dermatologist for a prescription strength that's a little larger. You might have other ingredients mixed in, like a benzoyl peroxide leave-on. We do prescribe topical and oral antibiotics at times for more severe cases. And so talk to your dermatologist about that. I also want to caution that when you use benzoyl peroxide, especially as a leave-on medicine, you have to take caution that it can bleach your clothes, your towels, your linens, pillowcases, and such. I like it as a cleanser because it does wash off. You do wash it off fully, and I don't have issues with it bleaching my towels. But if you don't wash it off fully, it will bleach your towels. So if you are notorious for getting things bleached, stick to white sheets, a white t-shirt afterwards, so you won't upset your mom or your wife. Keep that in mind. Benzoyl peroxide can bleach. Benzoyl peroxide bleach. All right. I would say that this is a very common issue, but let's switch over to fungal acne very quickly. When I was a resident, we called this, the formal medical term was Pityrosporum folliculitis. Now they switched it to Malassezia folliculitis. Malassezia is that yeast that we develop on our scalp that colonizes our scalp from a very young age. It causes cradle cap in babies and it stays with us for life. It's a commensal microbe. And this commensal microbe can cause issues like seborrheic dermatitis on the scalp, around the ears, in the ear, the eyebrows, around the nose and the chin, even go down to the V of the neck to our groin and armpits. It can also, though, from our hair, come down on our face and body and cause acne or folliculitis, inflammation of the follicle again. But you're having this yeast go down the hair follicle and cause these monomorphic red bumps that are technically acne or inflammation or folliculitis. You don't treat it the same as the traditional acne medicines, but you can use anti-yeast shampoos. Like I prescribe Ketoconazole 2%. There is an over-the-counter option, Nizoral 1% Ketoconazole that you could consider, but I like to prescribe, if you see me, the full-on 2% Ketoconazole. It's very rare though. A lot of people are talking about fungal acne and they're always asking me, how do I treat my fungal acne? I could probably count very few cases where it's truly fungal acne or Malassezia folliculitis. It's again monomorphic bumps, and I usually see it in young female teenagers or young adults with itchy acne on their back, right where the hair sits or falls. When I trained at Boston Children's, we didn't see that very often, but that was always a thought if a teenager had mentioned that their acne was itchy. And that would mean that we would treat it with anti-yeast shampoos. But it could happen on the face, on the sides of the face. Don't see that very often. So that's that. That's just a little thing on fungal acne. Didn't want to go too much into it because I don't see it very often. Acne, as you all know, it's multifactorial. There's no one cause for it. There's a lot of things going on, hormones, there's diet, there's stress. and such. So overproduction of sebum from being too dry or just being too oily. So there's a lot of factors playing a role. So I hope this video is helpful. Not too much nitty-gritty science, but I just want to go over this because it was a requested topic by you all. So thanks for giving me suggestions. I'll continue the Dr. Sugai review series, but also this Dr. Sugai explains. I know a lot of you like product reviews, but I really like to educate you on just different disease processes or pathologies of the skin. All right, and stay tuned to also my new series that I am developing with my YouTube manager, Christian Franz, SPF, Dr. Sugai's Pre-Med Forum, SPF. I thought it was very clever, so thank you, Christian, for developing that. We're going to be releasing videos of me speaking to undergraduate, pre-medical students, or even high school students who are interested in medicine. So stay tuned for that series. Very excited to meet you all on TikTok, Instagram, YouTube. So thank you for the support and reaching out. I'm having a good time. Let's keep it up. Take care this fall. Have a nice Halloween. Peace.